Minds in Motion, Take Control provides people with Parkinson's a non-medical standard of care through a program of evidence-based education, goal-directed exercise, and group support. Hello, I'm Jim Paterniti. This is Minds in Motion, Take Control, and the first in our series on falls and Parkinson's. It's nearly impossible to overstate the importance of falls as threats to people with Parkinson's. Falls are our enemy number one. In an instant, we can lose so much that we've worked so hard for. We want to take control of Parkinson's, we must learn to fall-proof ourselves and our care partners. You might want to hit the pause button and get something to take notes. If your care partner is nearby, they may be interested in sitting in as well. In this video, we'll learn that 1. Falls are very common in older adults, especially people with Parkinson's. 2. That people with Parkinson's can be badly injured because of the way we fall and the fact that we fall so often. And 3. We'll learn some practical steps that we can take to minimize our risk of falls and the risk of falls for our care partners as well. In a future segment, we'll look at goal-directed exercise to help prevent us from falling. We'll also look at how to minimize environmental hazards, which can also result in a fall. A fall can happen whether you're young or old, but folks over 65 fall more than any other age group. People with Parkinson's are very often 65 or older. The Center for Disease Control and Prevention tells us that 1 in 3 Americans over 65 falls each year, and that falls account for half of all the hospitalizations for trauma in people over 65. Falls are the number 1 cause of traumatic brain injuries. Falls are the cause of 90% of all hip fractures, and falls are the leading cause of traumatic death in people over 65, far more than traffic accidents. People with Parkinson's fall twice as often as their age group, and our falls are more traumatic too. Why? Why do we fall so often? Because of segmental rigidity, freezing of gait, shuffling, festination, impaired balance, stoop posture, lack of motor control, dementia, double vision, on and on, drug interaction, depression, fatigue, fainting. All of these are symptoms of Parkinson's and risk factors for falls. And if we fall, we tend to fall backwards. We retropropulse. As we fall backwards, you can hit your head and cause traumatic head injury and traumatic brain injury. We also fall sideways a lot. This puts enormous stress on the head of the femur and results in the hip fractures. People with Parkinson's have 4 times the rate of hip fractures for our age group, and often because we can't break our falls using our arms or turning our bodies. Falls are pernicious. Once you fall, it's not unusual to fear another fall. And once you fall, there is a greater chance of falling again. This is a club I don't want to belong to, the Frequent Fallers Club. Fear can lead to behaviors like avoiding unfamiliar places, restricting activities, or staying at home. These strategies don't necessarily prevent falls, as most falls happen at home, but withdrawing from friends and avoiding new experiences out of fear is not living well with Parkinson's. Let's talk now about how to reduce our risk of falls and avoid the consequences on our terms. To do that, we must understand our state of mind at the moment of a fall. Falls happen when our situational awareness is compromised. Situational awareness is our ability to identify, assess, and act on threats to our bodies from the environment. Situational awareness is heightened when we pay close attention to what's going on, and it's decreased if we're drugged, fatigued, or distracted. The hazards that surround us can trip us up. If we eliminate those hazards, we can prevent a fall. This is the interaction of behavior and environment. Drugs like cinnamon are the cornerstone of the medical treatment of Parkinson's. But we also take a lot of other drugs for other medical conditions. Drugs are not the enemy. They relieve a lot of suffering. But their primary actions, their side effects, their interactions with each other, all contribute to falls, especially if we're taking more or less than the recommended doses. Combining almost any drug with alcohol is like playing Russian roulette. Every one of us, our care partners included, needs to know what each drug we take is for, what its proper dose is, and be aware of the precautions necessary to maximize its safety. The best way to get this information is from your primary care physician or neurologist, but the fastest way may be to make an appointment with your pharmacist. They're qualified to answer most of your questions. They just may not be up on all the nuances of Parkinson's disease. Make a list of all your meds to take with you, including herbals and OTCs, over-the-counter compounds. And be honest about your intake of alcohol. Also supplements, especially herbals, and the use of recreational drugs. If you get confused with technical stuff, bring your care partner or another person with you to take notes and back you up asking questions. If your pharmacist identifies issues, ask them to consult with your primary care physician or your neurologist. It'll be no surprise that many of the drugs that you're taking, such as anxiety medications and antidepressants, are known to cause drowsiness and to increase the risk of falls. Just because the side effect or adverse reaction is on a package insert doesn't mean that everyone who takes it will experience that side effect. People acclimate. That's why some drugs are titrated up over time. If you get a lot of pushback from your doctor or pharmacist, consider changing doctors or pharmacists and let them know why. People with Parkinson's need to be extremely cautious about the postings on the internet, as well as the bad advice from other people. Be as skeptical of the horror stories about prescription drugs as you are about the miracle cures from natural herbs and supplements. At Minds in Motion Take Control, we practice evidence-based education. We're also volunteers with no commercial interest in any product. We unbiasedly review and vet the quality of science behind a claim and find the best practical actions that we can adopt to take control. Some situations that lead to falls are complicated and sometimes embarrassing. To illustrate, certain blood pressure meds and painkillers also cause urinary urgency and incontinence, as well as causing drowsiness. Most falls happen at home, and most of those happen in the bathroom. So here's the picture. You took your meds at bedtime with a full glass of water like you were told to. At 3 a.m. you wake up really needing to pee. Because you don't want to disturb your bed partner, you try to get to the bathroom in the dark, and guess what? You trip on the throw rug at the foot of the bed and you fall. Now you're lying on the floor, stunned but hopefully uninjured. You still have to get up off the floor to get to the bathroom in the dark. You still have to pee, and you may feel uncomfortable that you fell and you want to shrug it off. Get up immediately. Bad move. You're safest on the floor. First and always, assess your situation. Am I really okay? Do I need to call for help? Once you do a body check, take your time getting up. If you're lightheaded, if you're dizzy, get back down on the floor. Never be embarrassed to get help. You do not want to die from embarrassment. Lessons learned. Know what drugs you take, what they do, and what their side effects are. Refrain from drinking liquids, particularly alcoholic liquids, 2 hours before bedtime. Install adequate nightlights. Get rid of the throw rug. They call them throw rugs for a reason. Do not hurry to get up. And don't be afraid to ask for help. You don't want to die from embarrassment. One other hazard that you do not want to have happen to you. Constipation is a fact of life for many people with Parkinson's. Usually we manage it with a high-fiber diet, prunes, plenty of water, and an occasional stool softener. As bizarre as this sounds, being constipated can lead to a fall, in this case from the toilet seat to the ground. Excessive pushing and straining because of constipation can trigger dizziness. You faint and then you fall off the seat. The fainting is triggered in the same way as people who faint at the sight of blood. It's called a vasovagal episode. A word on traveler's constipation. Airplane flights can dehydrate you. Drink plenty of water and avoid the alcohol on a long flight. Time zone changes upset your circadian rhythms. If you add to that the changes in diet, it's not hard to see that people with Parkinson's need to plan to avoid constipation and falling. A related symptom of Parkinson's that contributes to falls is orthostatic or postural hypotension. This is the drop in blood pressure, usually triggered when changing body positions from sitting or lying to standing. The blood pressure drop causes lightheadedness, which can become full-blown loss of consciousness and result in a fall. Orthostatic hypotension is part of Parkinson's itself. About 1 in 3 people with Parkinson's develop some orthostatic hypotension, especially in the mid and late stages of Parkinson's. Obviously, if you black out when you stand up, you need medical evaluation. And I draw special attention to Viagra, which can interact with other drugs, especially blood pressure meds, causing a truly inconvenient episode of dizziness and fainting. Remember, ED can stand for erectile dysfunction, but if we're not careful, ED can also stand for emergency department. At Minds in Motion, we educate ourselves through our doctor and pharmacist anytime a new drug is added to our treatment, or anytime that we experience a new or significant side effect. Learning the proper practices can prevent episodes of orthostatic hypotension and dizziness, and in turn prevent falls. Don't let yourself get dehydrated, especially on hot days. How can you tell if you're dehydrated? If your urine is deeper yellow than usual, you may be dehydrated. Drink more cold water. Keep your urine to a pale color. Do not drink beer or other alcoholic beverages. They tend to make you lose water and make things worse. With people with Parkinson's, fluid balance is a double-edged sword. On the one hand, too little fluid and we risk a faint or fall, especially in the morning when the blood pressure is lower than normal. If we have too much fluid before bedtime, it increases nightly urination and the chance of falling. If you're prone to dizziness when you get out of bed, try elevating your head about 4 inches while you're asleep. This may help. Always take your time getting out of bed. Roll to the edge of the bed. Get up on your side. Drop your feet over the side of the bed and push yourself upright until you're sitting on the edge of the bed. Lie back down if you get lightheaded. Dizziness may not happen immediately, but could take up to 3 minutes. You've got to know your body. Orthostatic hypotension is a serious, potentially debilitating complication of Parkinson's. If you have symptoms, see your primary care physician or neurologist pronto. Be sure to ask her about non-drug remedies like elastic compression stockings or other devices to keep you from passing out when you stand up. Which brings us to vision and falls. People with Parkinson's are prone to develop eye issues that can lead to falls. Tiny muscles control our eye movement, and as Parkinson's progresses, these muscles lose the ability to converge, to bring both eyes to focus on a close object. This can lead to double vision, which is not a good thing for fall prevention. There's some evidence that double vision may respond to adjustments in meds, so I would certainly bring this to my physician's attention. Get a yearly eye exam and update your glasses if there's a significant change in your prescription. Be sure to tell your eye doctor that you have Parkinson's. Double vision is often corrected with prism glasses. In my case, I found that wearing progressive lenses increases my chance of stumbling going up a curb or climbing upstairs. My single vision sunglasses were less likely to trip me up. I consulted with my optometrist, and now I wear separate glasses for reading and working on the computer, and a prescription single vision lens for distance driving. So in summary, a fall occurs because of an accumulation of risk factors. Age and Parkinson's being two of the biggest and most significant for us and our care partners. Fall prevention is the result of many small changes in our behavior that improve our situational awareness. Our decision to take control of our lives as people with Parkinson's means that we educate ourselves to make the proper decisions and that we do our best to act on these decisions to truly live well. In an upcoming video, we will look at exercise and the scientific evidence that the right exercise can reduce the risk of falls in people with Parkinson's. This is information you'll want to have, so subscribe to this channel and you won't miss it. If you missed or were unclear about any of today's discussion, you can rewind and watch it again. Our all-volunteer crew hopes that the Minds in Motion Take Control program will empower you to take control of Parkinson's to live well. This is Jim Paterniti wishing you peace and abundant joy in your journey. Goodbye and live well.